Check.
Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing well. As you know, we're going to chat here, take your questions, cover a great deal of information, give you an overview as to what we can do to help to learn about your body, optimize your health, get you to exercise, eat right, reverse some of the progression of what we call the inevitable age-related change that happens in your body, bring down your cholesterol, bring down your weight, enhance your organ function, cellular function, the list goes on and on. So you certainly can call and ask questions about any of these things. A couple of the good articles I pulled today, one of them talks about how looking at your eyes can give us an idea as to whether or not you have cardiovascular or stroke risk. Physicians, when you get into medical school, within the first couple of months, when you're doing rotations in different things, anatomy, physiology, histology, biochemistry, you'll sit down with a doctor who's experienced and typically will show you how to do an exam. And one of the things you learn about when you do the exam with the light, looking to your eye to see how well your pupil will either constrict or dilate, looking at the back of the eye and looking at the retina, the blood vessels, is important because if those vessels are sort of puffed or looks like they're thick, like, sausage links, that may be a significant issue with either blood pressure or vascular issues and sometimes tumors in the back of the head or in the head that may be causing the pressure to increase in the eye. So this is a great study talking about 74,000 participants in a variety of institutions across the U.S. and Canada, and they're looking at those individuals that have smaller amounts, very simple connections between the blood vessels of the eyes, not this big map pattern that you might see if you're looking at a map of the United States with roads and highways and parkways. The people who have lots of blood vessels and lots of good flow are healthier and have less cardiac issue than the people who don't have a lot of blood vessels. So the microvasculature is what it's called. If you have simple and small numbers of vessels in the back of your eyes, then you have a higher risk of age-related changes, inflammation, cardiac disease, stroke. Very interesting study. And they went on to say that other studies have verified this and also added to that list of things dementia can occur. So as we look at you, we want to be able to figure out exactly what's going on. Of course, there are vascular causes of brain aging and vascular causes of aging of any organ, but there are also internal mechanisms. Heavy metal exposure can damage the organ from the inside out and damage how you make neurotransmitters, your hormones. So there are different things that could damage your tissues and make you age. So pretty interesting to see. Even within a basic look at someone's eye, looking at the blood vessels, you get an enhanced picture. And of course, we're looking at all the cardiac risk factors. We're doing EKGs, echocardiograms when needed. So we're looking at every area to give us the best understanding as to what your body's going through.
Someone's just saying in the chat, I could always tell when someone's having a thyroid issue with their eyes, but I didn't know about this.
Yeah. So the thyroid issues are a little bit more obvious because people have exophthalmos where the eye seems like they're kind of coming forward and kind of popping forward out of their head. That's usually a hyperthyroid mechanism. And some people have the reverse where they have hypothyroid and they just seem to be puffy and they can't, bring their weight down and reduce their weight. So yeah, these are all the things that we look at to try to understand what your body's going through. And of course, if there's the blood test, the physical exam, secondary exams, as I say, there are tests where we can send you for a transcranial vascular test to look at plaque in the blood vessels around your eye and those occurring right across, coming up off of the carotid, right across up into your head. And carotid artery, everybody knows about carotid artery tests, where they look for plaque in your neck, echocardiogram, abdominal, pelvic, sonograms looking at the organs and the vessels, echocardiogram we spoke about, lower extremity arterial tests looking for plaque in the blood vessels of the legs. So there are a variety of ways to see what your blood flow looks like.
Someone just asked, what exactly is causing the, how do you know that a stroke is eminent from the eyes?
So if the blood vessels are very puffy and tight instead of smooth and they're not always linear, but smooth and flowing. If you start to see that they're kinked or backed up or swollen, that means that there's pressure there. So that may be a sign of the increased pressure in your brain. So strokes occur in different ways. Everybody would understand that a stroke could be a break in a blood vessel because the pressure is high, a blood vessel breaks, the blood leaks out. The area that's supposed to get that blood flow at the end of the blood vessels now is not going to get oxygen, vitamins, minerals, and hormones, and those cells start to die. That's one mechanism. So that's a loss of blood into the brain, and when you do a CAT scan or an MRI, you'll see this big cloudy picture where the blood leaked out. There are other types of stroke where the blood's not leaking out, but you have a clot, and the clot, stops the blood flow from getting through that vessel, and that's a slightly different mechanism. In the second one, you would use a blood thinner to an extent to try to dissolve the clot, and there are meds that are used intravenously as blood thinners. There are some people who have a bleed, and if it's bad enough, the doctors have to go in, surgeons have to go in, and make a little hole, and then, take some of that blood out before the blood creates back pressure on the brain to cause damage to the brain. So it depends upon, the presentation.
This person said this is a little off topic, but how does diabetes-related eye damage connect to heart disease risk?
Good question. And it's such an extremely common phenomenon because as people get older, almost everybody has some vascular compromise or plaque or atherosclerosis. And the millions and millions and millions of people who are diabetic and who are becoming diabetic every year, who are pre-diabetic, and the numbers are skyrocketing. As you start to have the excess sugar floating in your blood, which you could check on your fingerstick sugar, you could use the device on your arm to watch your sugars 24/7 for 2 weeks. When your sugars are high, they damage the blood vessels, they can contribute to plaque, they can damage nerves. That's why diabetics frequently will have neuropathy. They can damage your eyes, any organ. Glycation is a term that means excess sugars are damaging proteins, fats. They could damage anything and everything. If you think about big blood vessels, well, you have a lot more flow, and it takes a long time to clog up a big blood vessel, like the aorta. But if you compare that to tiny blood vessels in your eyes, it doesn't take as much to damage or plaque up or inflame those tiny blood vessels. So the excess sugars that contribute to the cardiovascular mechanism, and maybe cholesterol and heavy metals and other things are part of that plaque process, the sugars and the others, the metals, will also get to small blood vessels and create more damage sooner and damage the eyes. So diabetic retinopathy is a very common thing. Macular degeneration, another degeneration of the back part of the retina where you're focusing your vision. So light bounces off things, gets into your eye, hits your cornea, then your lens, and the lens focuses the beam of light right at the macula so you're able to see. So degeneration or breakdown of any of that tissue causes pretty dramatic effect. That's why I want to really control your blood sugar, really control your cholesterol, eat right, exercise, create great blood flow, get vitamins on board to protect your cells because vitamins are food for your cells, get your hormones in the perfect range. Change this whole picture before it progressively puts you in that really bad zone.
We got some more questions, but first I just want to say, if you're watching our Rumble audience, our beautiful Rumble audience, and of course YouTube, of course.
Yes.
We love you YouTube. But
our amazing Rumblers, our amazing YouTube group.
If you want to check out the website, we got a beautiful,
look at this.
Look at this QR code. So if you want to check it out.
We are becoming so high tech, it's just staggering. So yes, you can hit the QR code, go right to the website, look at the videos of all sorts of different things that we do. Of course, the website also links to the podcast so people can watch it. I think, is it this week coming up that we're going to Monday, Tuesday, Wednesday, Thursday, Friday, 5 p.m. for our weekly podcast. So 5 shows during the week. Our big Saturday, which we love, our Rumble people, because they listen to us feverishly. We've been hitting over 100,000. I think we broke 200,000 a couple of weeks ago views on our Saturday show, here from 2:30 to 4 o'clock or so. And then we're going to replay that on Sunday. So we'll have every day, programs for you to watch and see, and hopefully like and subscribe and go to Instagram or whatever else people are supposed to do.
There we go.
So thank you so much, everybody, for watching, listening, commenting. This is what I'm here for. This is what we're meant to do for you.
So we got just a question on the technology side. What kind of tech lets you see blood vessels in the eye? Is it that retinal camera thing? Like, how does that
Yeah, so ophthalmologists have a variety of things. And every time I go for my eye exam, not only do they kind of put your chin in the device and they have you look at a farmhouse, I don't know the name of the device, but it just takes a beautiful picture of the contour of your eye. And some of the ones that have the flash will also, because I've seen them, on the computer and then they print it up for the doctor. It shows you the contour of the cornea, how thin it is. It shows you the contour of the retina, if there are areas that are damaged or breaking down. It's a really beautiful view that is dramatically more than what anybody could see with the naked eye. When the ophthalmologist will put the numbing liquid on your eye and then some gel and hold that large magnifying glass, they're looking, beautifully in a much better view of the size, the shape, the blood vessels, the optic nerve. Is there cupping there that would be damaged around the optic nerve? But there are a variety of tests that will look at every component there. And of course, they take pressure. So for those people who want to make sure they don't have glaucoma, because glaucoma will destroy the eyes.
Someone's saying I should be nicer to my eye doctor going forward.
Absolutely.
You should be nice to all your doctors.
Absolutely. And also, it kind of goes without saying, but sometimes you have to say these things. Make sure that your primary doctor, whoever you're seeing with any frequency, gets the note from the eye doctor. The eye doctor will say, hey, the testing was great, no problem. Or this is what we're seeing. And then you correlate that with what you're looking for and finding, and you try to change it.
We got some funny ones in here. If the eyes are the window to the soul, are they also the window to clogged arteries?
Yes, they are the window to many things. Yeah, no, it's true. I mean, you could tell a lot by looking at someone's eyes, medically and emotionally and psychologically too, I guess.
Someone just wants to know for their annual physical, should they be getting EKGs as well?
The EKG is a good test. However, it's a 1 minute or so, sometimes less, electrical read of your body lying at rest. So it gives us a little bit of information. If you have a major arrhythmia, you have a major issue or blockage, you'll find an abnormality on the EKG, but there are people who don't have an abnormality on that 1 minute read on the EKG, but if you were to put them on a treadmill and do a stress test, or which we like to do is give you a device that you wear at home for a week, and we're capturing roughly 60 beats per minute times an hour times 24 hours times 7 days, I think it's 600,000 some odd beats. You're looking at what your body's doing when you're sleeping, when you're walking, when you're working, when you're doing exercise. So it's an amazing test to give us a lot more information than just, maybe a minute's worth. So 60 beats or 600,000 some odd beats. We should look at that number again because, 60 beats a minute times 60. And yeah, you're talking about a few 100,000 beats. That's a lot. That's a great test. So as I tell people, that's a great test. An EKG, once in a while, is not the greatest thing. With what we're doing with the RPM and evaluating people at home where they take their blood pressure, every time they get a reading, they send it, it gets to our computer, blood sugar, a smartwatch gathering, rate and rhythm and oxygen. It's just genius to be able to have this information so a doctor can say, yeah, all your numbers are great. They're great every day this month. I'm happy that you're in a good zone. Or you're a little bit off. Let's fix this. Let's fix that. Let's correct some nutrients. Let's bring your pressure down a little bit more. Sometimes we give people blood pressure medication to calm it down. They lose the weight. We get them off the medication. So, how many doctors get readings like that? You don't. You get 2 or 3 times a year a reading for blood pressure or some of the, glucose readings, but we'd love to have that much more. It's so much better.
Got someone saying that their smartwatch said that they're resting when they're sleeping at 66 beats per minute, and it says that that's high. What are your thoughts on that?
It's not high. I mean, some of these devices you have to look at where the parameters are set. So if we have a device and we're looking at someone that has arrhythmia or tachycardia history, I want a nice tight range. And if they go too high, I'd want to be alerted and know. But 66 is fine. A pulse of 60 is phenomenal. It's like a kid. 66 is fine. If you're 90 or 100 or beyond, that's a bigger problem.
I got a few here. So this person has 20/20 vision, doesn't really go to the eye doctor often. How often should people get eye exams? Just as far as
without having any issues, I would go twice a year. Because I've seen people with, good vision, but start to have changes in their eyes, because their pressure is high. Or they have cholesterol issues. Or they may start to develop a cataract. So having good vision is great. That's one part of it, though. That's only one part of the picture.
You're making me. I got to schedule something soon.
It just makes sense. That's why when we do our big blood test, that's done first, and then a week later we go over it. And anything that's abnormal, we would recheck within 3 or 4 weeks, but we're making recommendations to change the abnormality, so we want to prove that what we're doing is working. And a person might do smaller versions of the blood test, whatever the abnormals are, 3 or 4 times a year, so we can track the cholesterol, make sure it's good, and make sure your vitamins are in great range. So that's just one of my crusades, is to make sure people have terrific vitamin levels. That's critically important. Hence doing the blood test about vitamins and then reviewing it, putting together vitamin recommendations in the vitamin pack now, and then retesting to prove perfect levels. So
we got a little story here. Someone saying, I went in for what I thought was a regular eye exam, nothing serious, just updating my glasses. The eye doctor gets really quiet, leans back and says, you need to get your blood pressure checked today. I thought he was being dramatic, but he showed me the picture of the blood vessels in my retina, tiny little hemorrhages and narrowing. Right. He said can be early signs of stroke and heart trouble.
Yeah.
I went to urgent care right after the appointment, and sure enough, my blood pressure was sky high. They told me if I didn't catch it when I did, I could have been a walking time bomb.
Yeah.
My question is, how in the world can an eye exam pick up something my regular checkups missed, and should people be getting...
The regular checkup should include blood pressure readings, and if a doctor is concerned, tell you to get a blood pressure cuff and at home, do 2 or 3 readings a day and then send those to the doctor. That would be important. What we're doing with RPM is you get the device, it automatically sends it to our computer. But like anything else, how can I put it? If you start to lose vision, then that's the loss of blood flow and all the great nutrients to the eyes. That obviously would be a sign of a stroke. This is way, way, way before that, where your blood vessels are just stretched out and they're leaking and they're little, pinpoint hemorrhage before a bigger event can occur. So it would be nice to say we didn't see this that often, but we see this a lot, and everybody's stressed out today. After having 5 years of crazy stress with everything that's gone on, people have higher blood pressure than before. So that's where we're constantly tracking it.
We got a comment just saying, we missed you last Friday. I was waiting for my my Charlie Kirk update.
Oh, yeah, there's so much that's going on now. We were talking about this all the time. Videos from different avenues, people who said that they were there helping him that you can see on the video were not. There's no ambulance there. There was, no real care. And people... The videos of multiple people of videos showing the truth of what, people said, I did this, I did that. No, you didn't. It's completely coordinated, assassination. That's what it was. And there's no question about that.
Yeah, and you point out the ambulance thing. Like, if you think about, just the insurance and all these things you have to get for these huge events, like
Sure.
an ambulance, multiple ambulances
Sure.
need to be there. A crowd like that. It's not even about him and them. It's the crowd, heat stroke, whatever it may be.
Sure. Something came out, we spoke about this before, that the venue was supposed to be inside. They wanted it inside, but then the school said they wouldn't be able to protect and have enough security to have it inside. Yet you have it outside where there's the possibility of a million different things because everything is so, wide open and not covered. And, and were there police from that town there or their state police there? Nobody locked down the crime scene. It seems like it was all created with all the wrong things in place. And this happened easily without any issue. And Candace said there were at least 12 cell phones that were directly linked to Israel at the time, there at that time. There's a kid on the video raising his hands right before the shooting because he's the one asking the question, apparently, raising his hands as if he saw someone get shot. So he's practicing.
Yeah, I saw that.
And
That
these
was
are all
weird.
videos that everybody can see. So I don't like all of what's happening. People are being told now to delete their videos who were there, who were eyewitnesses.
Oh, yeah, by the FBI.
What's that all about? And the hospital has no information. And why do they take him to a less than, significant, tertiary care hospital or a place that's supposed to handle gunshot wounds? This is all wrong. And to have one or two things screw up, maybe, but multiple things doesn't work that way. I have patients and friends who are military. They said, this was absolutely a military, engagement. It's what it is. I feel bad.
Yeah.
I also have issues with, I don't need to go into it too much, the fanfare and the hoopla afterwards. And of course, having his wife get on stage and with the streamers and whatever that is, flowing and everything was like a
Concert.
Yeah, it just rubbed me the wrong way. And she's not crying at all. There's no evidence of her crying. And she's wiping what? There's no tears. So people talk about this all the time online. It just doesn't make sense to me.
Yeah. And even if just the fact, like, you're having this woman go on stage, like, let her grieve, if that's the case, It's just bizarre. Days after.
So
Someone said
Candace is one of them, and there are a few of the others that are out there, and Rogan and stuff are saying that this was just so quickly pushed into, Erica's going to be the new head and blah, 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 blah. And apparently the money that was refused by Charlie has already gone into Turning Point USA. So that $150 million was brought in and blah, blah, blah. And now they're talking about this other kid, Mikey, and, he's wonderful. And he didn't leap into action. He saw Charlie get shot, and he walked away quickly on the phone. Who wouldn't go to see if they could help their friend? And the other guy, Frank with the white hat, he said he didn't cradle him. He fell to the ground. He was scared, and he went behind the tent. Everyone can see this. This is all horrible acting. It's all a concerted effort to get that done. So
and an interesting thing that's going on, a lot of people that are doing their own investigations, because it just seems that the FBI is, at least if they are doing an investigation, it's just very, very secretive.
they're not.
These people that are reaching out and talking to Turning Point people said that they've found out that Turning Point actually basically put in a software where whenever they're sending out emails now, each person that gets an email will have a slightly adjusted, a letter or a word changed, so that if there's a leaked email now, they will know exactly who leaked it. And they've spent a lot of money on this software. It's like, well, why do you care so much that there's a leak of your internal emails? It's just like, what are we doing?
It's just
making
there's
yourself-
something very, very wrong about the whole picture. From what I could understand, and it's not hard to understand, that Charlie was a nice guy, a great guy, religious, God-loving guy, wanted to be great for his country, wanted to be fair, etc., spoke his mind, engaged with people that hated him and just tried to have conversation. You can't ask more than that, from a person. And, he rubbed certain people the wrong way, didn't want to continue to shill for them and be controlled and bought, as I'm sure politicians are, by certain world leaders. And this is what happened. But more and more is going to come out. You'll see how it works behind the scenes. It's just a shame.
Craziness. You got us going, guys.
Yeah.
Got us going.
We'll give you my opinions and things as we
See
start
us
to
at
continue
dinner,
to see
all
it.
right?
Yeah.
What else we got?
Let's chat a little bit about Moolah Farms, one of my favorite new places. Moolah Farm, Christina and Sal have a terrific farm. Upstate, they have a gigantic farm with all sorts of animals, which would be cool to go see and hang with the animals. I always wanted to do that.
You tell me.
But
I'll be there.
yeah, absolutely. We've got to do that. Maybe we'll do a show up there. On Sunday, they're in Huntington at a big fair, the Huntington Market. So people go there, they order food, they get food, they buy it right there. They contact them on Instagram and order food and pick it up. They have a big area in Brookville, and they have a bit of a small little shed that has a refrigerator and a freezer in it. And you can drive up there. You can see the whole organic milk, the eggs. They make little cakes and, pastries, yogurt, honey butter. They have in the freezer, all different sources of sections of meat, chicken, steak, beef, etc., all sorts of things, and really healthy organic food. So they do a great business. And I stood there the other day with Sal, was talking about this. So I went to buy some stuff, brought it to my mom's house, gorgeous free-range chicken. It's all really healthy organic food. So I'm a big fan of that sort of thing. And I don't know that many other places around that do that and have such a variety of things. Here's the little card, which of course would be hard for you to read. And that's their little card or brochure, moolahfarm.org.
I could zoom in on that.
Yeah. Let's see. So it has all of these cool things, moolahfarm.org. Is that a QR code at the bottom? It's too small to be able to.
Yeah. We'll get one.
Yeah, moolahfarm.org, and they're on Instagram. But take a look. I went to another place just because my friend Ray told me about it.
I know Ray.
Ray is a connoisseur of all things fascinating. He owns a great dry cleaning facility north of Northern Boulevard, right off Glen Cove Road. And we pontificate, we go out to dinner, we have conversations about everything from A to Z. And he's a huge amount of fun. I wish we could do like a reality show at his place because he's hysterical. But he sent me to another place. I forget the name of it, but it was deep in the most northern parts of like Matinacock or somewhere way, way, way north and back. And it was a cool little place that had organic chickens. And they have eggs and things. So it took me a while to find the property, driving back and forth, asking people where it is. There was only a small sign. You'd think that if people want to make a business out of it, they'd have a bigger sign. But you should get to. So I get there, I get out of the car. As soon as I step out of the car, all these chickens are looking at me like I'm from another planet. And there's hundreds of chickens. Every color, every combination, speckled looking, black, white, whatever, crazy looking things. And they're like looking at me. I'm like, this is pretty weird. It's like out of a horror. It could be a great part of a horror movie. So I walk over to the fridge, and you look inside, and they have brown eggs. And I buy some stuff. You put the money in the slot, which is nice. It's healthy, organic, free range. And now little groups of chickens are moving towards me. So I'm like, here, chicken. And I left my driver's door open on my truck, my SUV, because who thinks of closing the door? And the chickens were walking towards it because they wanted to jump into the truck. I said, okay, this is just a little bit crazy. Then as I go to try to leave, the chickens were like blocking the road. And I'm moving the car up a little bit. They didn't want to move. And I'm beeping the horn. They didn't want to move. I'm like, this is like a surreal experience. So I got out of the truck and I walked over to them and I kind of like shooed them away from the road and was able to get home. But it was a pretty cool, scary, chicken experience.
Someone in the chat is saying that there's a farm a couple miles from them where they just have a vending machine out in the front where you can just buy these fresh eggs. And it's just a game changer.
Great idea. You'll never go to regular eggs again if you have those.
They're so good.
There used to be a place that might still be there in East Hampton called Iacono's Farm. So if you go into the town of East Hampton, on the right is the big jewelers. I guess it's London Jewelers. So before you leave the town, there's a street that you make a left on. And that's just an obvious street. You could see it. You know, there are stores all over it. And then there's the Golden Pear and breakfast places down that next street. But if you take that street, go a little bit to the right, there's a train tracks, go over that. And on the right is the farm. So years ago, in the 90s, and maybe even before that, I used to go there to get fresh eggs, fresh killed chicken, you know, because they go and do it. And they hand you this brown wrapping paper, you know, with the chicken in it, and it's warm, you know. So I'm sure that they put it in a machine, or they cut it, bleed it, put it in a machine to just get the feathers off, however they do that. And I've never had chicken that tasted like that, because it was just alive in 1 minute, unalive the next minute. Then, you know, you bring it home and you cook it. It's like, wow. But I like healthy, you know, fresh stuff.
Yeah, someone in the chat just saying it's incredible when you go to Italy and they just have all of these little stands and everything's so fresh, and we're just so whittled by Stop and Shops and all these places. It's just...
I talk about that a lot because I have pictures in my office of my exam rooms of where I've gone on vacation, you know, Rome, Florence, Venice, all over Italy, you know, France, you know, Ischia, all these different places. And kind of my thing is not to go to the big famous, you know, tourist trap restaurant, and I'll go just to go to experience it. But I like to go like down the block and out of the way and find something that's good and organic and not overrun, you know, by tourists. And if I speak to the concierge at the hotel, wherever I'm staying, I'll say, I want to go where you would want to go eat, you know, not to be on a line and wait for some big overpriced thing, even though prices there are a fraction of what they are here. And they'll invariably send me down a street to a little building, and it's a little restaurant with tables outside, something very nice, and tables inside in the kitchen. And upstairs, that's where the people live. So that's their home. And they cook for themselves in that kitchen, and they eat there, and they feed people from their own kitchen. So you can't really get better than that. And if you talk to them, as I invariably do, because, you know, on my mother's side of the family, if someone's listening, we come from a long line of talkers. So
I think I have the same.
talk. So you talk to people, you find out the story, and then they walk you down the back and they show you their farm in their backyard, and they show you all the vegetables that they have. And it's almost like this scientific thing where they have this process of the tomatoes and how they harvest. And it's just a huge thing. And it's just, it shows in the quality of the food, you know? Like you're saying, it's just you don't get that taste anywhere else because that food is in perfect soil. They compost the soil with natural components. But and I try to do that in everywhere I go because I want to find that out of the way place. So that's always been the best way to do it.
Someone in the chat just saying, I feel like you're someone who, you know, secretly is fluent in Italian. Do you parlo? It's
interesting. I can speak Italian when I get there. Over here, I might struggle for words because my mind is not in that switch over. But when I've gone to Europe, you know, Rome, Florence, Venice, etc., Monaco, Ischia, you know, Saint-Tropez, all of a sudden, boom, it's like, wow. It's like a switch was just thrown and I could speak it, not perfectly or fluently. I can't speak it like I was born there, but I get around easily. So it's interesting how your brain does that.
And then some just, you know, they talk so fast. They're like, I think I got you.
Yeah. If you catch every other word or every other gesture, then sometimes you can pick it up. I think speaking fast in any language is just like, you know, you just can't follow it. When I did my internship in Brooklyn, I had a book that translated Spanish, Italian, Russian, Polish, because in these areas, and certainly by Coney Island Hospital, which was a big part of our rotation network, there were people from every background there. So every intern, doctor, student would buy the book and read how to ask, your medical questions in those different languages. So I'm sure it was kind of funny.
Yeah, right. It's like you're going through the book. What did he say?
And then sometimes you pronounce it wrong and they look at you like, I'm trying, lady.
Shame.
I'm trying.
Shame.
I'm trying. Let's see what else we have here. Another interesting study, and this was more as a secondary comment on diabetes, because we spoke about diabetes a couple of weeks ago, but we have to continue talking about it because it's an overwhelmingly horrible disease. So there was a doctor group and a study that came up with an idea of the life's essential 8 things, with diabetes. And 35,000 people in the study. And it's kind of obvious, but when I see patients, I can't just tell them, yeah, go exercise. That can't be the last sentence of the comment. I have to say, you want to do 30 to 45 minutes a day. You could walk around, your block corner to corner, slow, brisk, fast, keep changing speed, fast, slow, fast, brisk, The reason why that works really well is because you see the corner. It's just a few minutes away. It's not like you're like, oh, I have to walk 5 miles to hit my mark. You see your mark, you hit it, you go left or right, you see your next mark at the end of that block. So it's easy to reinforce that process. So you can't just say you should be more active, because some people will walk away and not do anything. Indoor bike, outdoor bike. I give them all sorts of ideas of things to do. Some people live in a hilly area and they can't do the hills. I say, well, just walk around the perimeter of your house or your property, or walk back and forth here. There are a lot of little ways to do it, and even make a game of it and get family members and friends involved. Some people drive to a mall and they get there as soon as the mall opens, and they'll just do laps, throughout the mall. Controlling cholesterol levels. Well, you can't just say that. You have to tell them the way to control cholesterol levels is cut your carbs down. We give them a low-carb handout. We give them a green sheet that shows them foods to substitute to be able to achieve that. The exercise, correcting hormone decline, because if your thyroid, DHEA, testosterone, IGF-1 are low, you're not going to burn the cholesterol as well. So we had to explain it. Following a healthier diet, way too general a term. Getting enough sleep, well, yeah, we try to get people to sleep as well as they can. For a lot of the anti-aging protocols, correcting IGF-1 or sermorelin, which gets you to make your own IGF-1, will really help you sleep. It's great for mood, memory, sexual drive, exercise, endurance. Managing blood pressure, not smoking. Yeah, these are common ideas. It's almost like I would say, well, why even do a study? That's pretty obvious. But the study shows this is what people did and this is their results. So, it makes sense.
Someone once said, I keep hearing people say that A1C should never go above 8. What exactly is A1C?
Should never go above 5.7. Hemoglobin A1C is a measurement that's an average of 3 months of your blood sugar levels. So if you go and pig out and eat pasta, bagels, pizza, whatever you're going to have, and your sugar levels go up, that will tend to raise your A1C. So if you're eating a lot of carb over the course of a few months, it's going to be higher than you'd want, which means the sugar is staying in your blood, causing damage to your cells, to your organs, your vessels, your nerves. So if you're at 8, there's probably some times when you're not at 8, but if 8 is your average, that's horrible, because sometimes you're 10, sometimes you're 7. We'd rather have you at 5 even, because that means your sugar is nice and tightly controlled and can't create all that damage. So that's why we cut the carbs, do the exercise. For people that are at 6.5 or higher, you're diabetic. If they're 8, they're absolutely diabetic. So again, low carb, exercise, correct vitamins, minerals, hormones, and we do stem cell. Because doing a stem cell procedure will get new cells to your pancreas that become pancreas cells, brand new cells that make insulin. So you're making a younger pancreas and adding more new cells to the mix. So that's why that's so important. But an 8 is not a good number.
Can you just go over exactly how stem cells help diabetes? I know you've mentioned it in previous episodes, but I've been trying to explain it.
It's pretty straightforward. So the first thing that we talk about is that you have cells in your bone marrow, maybe trillions and trillions of them, that are there to become other cells. Just like when you were born, you have trillions and trillions and more of those cells that help to make your nervous system, that make your heart and vascular system, your lungs, your brain, your skin, everything. And those cells can become anything. As you get older and you have damage, you're not jumping billions of stem cells from your bone marrow to your joint to repair your knee or to repair your organs. They're still there. They may leak out and help to some extent, but what we're doing is we're taking them and getting a good number of them once we extract from the crest of your ilium, which is the lower part of this bone here, not your spine, not your hip socket. It takes a minute and a half to extract, then we spin it for a half hour, and you're separating red blood cells, plasma, stem cells. When we take those cells and put them into your knee, they know to go where the damage is because that's what they seek out. They seek out damage, degeneration, or inflammation. So when they get to a tissue, they can weave in and become new cells of that tissue, so now that tissue creates repair. If we do it intravenously, as we do for liver, kidney, heart failure, lupus, rheumatoid, diabetes, etc., and diabetics, for example, the signals that are coming from your pancreas where you have damage and degeneration attract stem to that. They become brand new pancreas cells, and they keep dividing as new pancreas cells, so now you've regained your ability to make the insulin. So putting the stem in, we'll go to any area of damage, degeneration, heart, lung, liver, kidney, pancreas, gut, etc., and become brand new cells where the damage is. That's the essence of stem cell. That's the absolute of stem cell. So we've seen people within 2 to 4 months, sometimes 5 months, sometimes 6 months become non-diabetic because the stem goes in and creates new insulin production. And we can see that on your blood test, your C-peptides, a measurement of your insulin production. We could look at individual random insulin levels. We see your sugars coming down, A1C coming down, and you add the exercise and the vitamins and all of that, people get a terrific outcome.
Someone's just saying that ever since they've been watching this show, they've been paying much more attention to stem cell. And they were reading the other day that researchers have found that stem cells from fat tissue can repair spinal fractures similar to those caused by osteoporosis. Amazing.
Yeah, so the two places to get stem from your body would be fat or bone marrow. The only drawback with fat is that you're not getting as many stem cells, even if you suck out a lot of fat, because there's less there. And when you do a liposuction to take the fat, which we've done years ago, because that's one of the things that started with clinical trial, you have to use collagenase, which is a naturally occurring enzyme to break down collagen to get more stem cells out of the matrix. And a few years ago, the FDA sued a Dr. Berman in California because he's a plastic surgeon, was doing lipos, taking that, spinning it, adding the collagenase, and getting stem cells and doing that treatment. They said that if you use the collagenase, you're making stem cells into a drug, which you're not. That's complete BS. But they wanted to make him spend a lot of legal money to battle with them, and he won in the long term. He's a plastic surgeon, so I guess he can go through all the legal costs. So the FDA probably has, I don't know if they still do, some issue with fat. I don't think they should. Your bone marrow is the best source, and it's got the most stems, so that's why we use that.
Someone said, no dig on RFK, but how are you not the Surgeon General? What the heck?
I love RFK. Every time he does things and he talks about things, and he's totally like a people's champion, Got to get him on the show somehow. I got to meet somebody who knows him. But See, the Surgeon General thing, a government position, I think Trump has given him full reign. Go do what you need to do, Bobby. Go and run. And he's doing it. I think in any other circumstance, you do what you're told to do by some group of people that kind of put you there. I think former surgeon generals and people in those positions were just told what to do, and they just went along with the status quo because that's what fit the narrative, But, these guys, our administration now, they don't fit the narrative. Look at all the, U.S. aid money that's stopped, wasting all this money outside of the country. Keep people here healthy. Stop the crime and stop the things that are going on here. Create better, health care. Create better insurance plans. Fix Chicago. Stop all the gun violence there. People killing each other. Don't send trillions of dollars out to other places. Why? Put it back into your own people. So all this is changing for the better. More studies now coming out that SIDS, they think, is correlated by vaccines.
What is?
SIDS, sudden infant death syndrome.
Oh, yeah.
Because a study just came out proving that, and the case, it was a big legal case, where they, were in favor of the discovery that the person was given 5 vaccines, the baby, and then died of SIDS like a week later. You can't give 5 vaccines at once or 10 vaccines at once, whatever the number was. It's insane. And they keep trying to look at other things. Oh, maybe it's a new genetic thing happening in every population. It's just so wrong. The most glaring thing that creates the problems for the spectrum, kids, the most obvious thing, the most glaring thing, and they don't want to question it because you can't question what the status quo wants to keep doing.
Yeah.
Keep pushing injectables. It's dangerous.
Yeah. And John in the chat is just saying it's incredible to see the hysteria when this man is just trying to make everyone healthier. And everyone's been complaining about these things for decades. And finally, someone is there.
Yeah. Finally, someone came along with significant intelligence, significant wherewithal, significant strength and courage to get up and do the right thing. And of course, he never would have been able to get to the spot without the president. But, I think I like Dr. Oz. I think all these guys are working as a great team. And you're going to continue to see amazing things done and things done to help, Americans and help our people. That's what they're doing.
And the fat drug is cheaper.
Yeah.
A win. Yes, I see you, Gloria, in the chat. We also have that clip if you want to throw it on.
Yeah, we got a great clip of a gentleman who had a stroke. And Luigi's a great guy, born in Italy, came over here, very hard worker, etc. And he had a stroke, and his thought process was shot, couldn't speak well. He lost the ability to connect words in Italian, which is his first language.
Wow.
So for some weird reason where his brain was affected, not only was he unable to speak, and speak certain words or sentences, he also lost the ability in his original language, which is it's pretty wild. And I saw him recently, maybe a month or so ago, and he's fine. He's doing great. He's, lean, does the exercise, the diet. He has no risk now, but maybe things were not great in his body for a few years, which allowed him to have the stroke. So he did the stem cells intravenous and nasal droplet, and very quickly he started having great results. So this is another terrific video.
Hi, my name is Luigi Farina. I'm 71 years young. I had the misfortune to have had a stroke 5 years ago, and being hospitalized with the stroke, the stroke affected my left side of my face and severely impacted on my speech. I was in the hospital for approximately a week, and many diagnostic tests took place. And with that, I realized that the sensation on the face was coming back, but it greatly impaired my speech. The doctors at the hospital started with, by the time I finished the hospital, started with speech therapy, and my speech therapist worked on my English speaking speech. I was in therapy for over a year. I was able to get some of it back, but I had a problem finishing sentences, putting several words together. But after a year, it was somewhat improved. But the other problem was that my first language in life was Italian, and that was totally destroyed. I couldn't speak to people in Italian more than 2-3 words at a time. It was very, very choppy. But strangely enough, my educational language, which I learned in school, was Spanish. That's my third language. I mean, Spanish was not affected by the stroke. Now, doing the diagnostic test, they also found that I had occasional AFib. And to monitor that in the future, that could have caused the stroke, they put something called the loop recorder into my chest. It's a little tiny chip, and that monitors, according to the cardiologist, when I have AFib. About a year ago, I had the pleasure of coming to see Dr. Calapai, and he did a full workup. So during the year time, we worked on increasing the minerals in my body, getting the right vitamin levels, and many, many things that helped me feel better. We're also working together. We realized that the stem cell therapy might be able to help me with some of my issues. So last August, we decided to do the stem cell, and immediately, within 24 hours after doing the stem cell therapy, I realized my speech was getting better. Within 48 hours, I started talking Italian much better even, which was horrible up to the stem cell therapy part. And as of now, which is months away, my speech is much better. It's much faster, much clearer. And my Italian, I enjoy speaking to the Italian members of my family in Italian because it's greatly improved. I also had a cardiac visit last week with my cardiologist, and with that, they checked my loop recorder, and it's been almost 6 months, and I haven't had an episode of AFib at all. Now, incidentally, part of the whole thing too is I was having a problem with double vision, which was caused by muscles in the eyes, and I had to really focus real hard to get the sight straightened out. And now, after having the stem cell therapy, the focus has become much easier. I can sort of relax a little bit, just stare for a second, and my eyes clear up, my eyesight clears up. So I'm very happy I made the decision, and hopefully it'll keep working to make my health a lot better for the future.
Wow. Yeah, it's a great video. I forgot that he said that his Spanish speaking was unaffected, which initially, I said, wow, that's weird. So English and Italian were affected, and his speech and recall were Spanish were not. So that just makes me think that your brain uses different areas, different components for different things. So there's the occipital area, there's language and word retrieval, but maybe one area of that language and word retrieval was affected and the other area was not. So
That's incredible.
it's pretty curious. I've always wanted to try to do a test to look at the flow and the metabolism of the brain before doing the stem and repeat it and do it afterwards. But most of those tests require doing an injectable dye, which I'm not sure that I want to have the patient exposed to, because that could create more damage in a brain that already has enough damage. So unless they come up with a test that does not include a dye or some sort of injectable that has side effects, I'm not likely going to recommend those tests because I just don't want that stuff to be there long term. Because those dyes, obviously the heavy metals and such can stay for a long time.
Yeah. We got someone in the chat just saying, this is back to the previous point, vaccines I got sick from, I found out after, tetanus injection, lockjaw, ear-to-ear mandible, still paralyzed.
Yeah.
Crazy.
It's hard for people to find a doctor that they can just sit and talk to about anything. And this is what we've always done with patients, but some doctors just don't want to talk about these sketchy or difficult topics. I have a lot of patients that have long haul COVID, for what it's called, that have a lot of other issues, and we're seeing more patients that have these cancers pop up again, from recurrent injections. So the statistics are there.
Yeah.
It's just horrible that the status quo has just created this, mechanism and scared people into doing things that may be damaging to their health.
Yeah. My last primary care doctor, I just stopped going because he was like, the first thing, he's like, oh, do you have this vaccine? Do you have that vaccine? I'm like, no, I think I'm done after COVID.
Yeah.
And he had a problem with it. I'm like, I'm not going back to this guy.
It's a shame. An absolute shame. So the Garden City office is 516-794-0404. If you'd like to call and chat with the staff, set up an appointment. Remember, we're doing telehealth visits if you can't get to the office. Then we send you a prescription, get your blood done. And even for those people who want to get on a perfect vitamin plan or recommendation, and we'll have QR codes and we'll have more on that within the next week. I have a landing page that explains what we're doing. People typically can call the office, set up a telehealth visit. We get the lab to get blood work or give you a prescription so you can get your blood work done at whatever lab you use. Review the blood work within a week, and then put together perfect vitamin recommendations, and then you're set. And then recheck the vitamin component blood work down the road to make sure your levels are perfect. So for a lot of people that are taking vitamins, and all the patients I see are, we have to fine-tune them to get the right combination, but not overdo it with 100 pills a day, which some people are going a little bit crazy with that. But we want to be able to get that set up for you.
Yeah, and to you, Gloria, I see you in the chat, talking about the lockjaw and the paralysis. Maybe set up an appointment. Who knows?
Yeah, you can only benefit from a great deal of knowledge about your body. Your body will guide us and tell us what we need to do. We participate with Medicare, so for people that are 65 and older that have red, white, and blue card for Medicare, we bill Medicare for your visits. So it's a lot of great information, a lot to learn. Also, we have a lot of people that are asking about vitamins. So, as I say, we'll have another QR code to look at for vitamin recommendations, vitamin specials, etc. So we understand that people have their doctor that they see. And for some people that call the office, we tell them this is the blood test we want to do. If they want their doctor to do that blood test, have us review it, that's fine, and we do it. So whatever works for patients, we try to accommodate them as much as possible. Our big Rumble crowd. We love our big Rumble crowd and all their questions. And we love YouTube and everybody, so we're excited.
Shout out LFA.
LFA, LFA, LFA. We need to have an LFA flag that we can wave.
I think Jeremy could take care of that.
Yeah, a little LFA flag in the corner. Yeah, so as we've mentioned, we're so excited that they put us up on the front page of Rumble. So at 2:30, when the show airs, then people can watch it directly. And people could watch all the shows on YouTube because we put them all there. But as you're watching now, people can see it right on Rumble's page. They have a big window, and you'll see the entire program. Me using my hands to make gestures about everything. 1,000 points of light. Oh, boy, oh, boy. Okay. If we don't have any other questions, then we shall sign off. Please tell your friends and family to watch the program, LFA on Rumble, YouTube, Spotify, whatever, all the other channels that we're on. Remember, Monday to Friday, 5 o'clock, 5 p.m. And again, everything's on, visible on Rumble, and even the prior shows. Almost a year's worth. We have to have a big party. December 13th is a year?
Believe. 13th or 14th, something like that.
Can have a big party. People bring the dogs in here. We'll give them treats.
Get a little cake going.
We'll have, some big party.
Cake might be a little dangerous, just me and you, Doc.
That's true. It may have to be a almond flour cake, so there's no grain or GMO or whatever. So I just was telling one of my friends, I bought a lot of good food at Bula Farms, and I went to BJ's because I'm always looking for gadgets. I'm a gadget person. The story with me is that my family always makes fun of me because I'll go to BJ's over the years and say, wow, a panini press that makes waffles and pancakes and this and that. And I don't make a lot of that stuff, but that's pretty cool. I should get that. You know, they have it cheap, maybe $70, $79. I'd buy it. The cleaning lady would put it away. I'd never see it again. Then I'd be like, oh, look at this. A panini press. Do I have a panini press? But I haven't seen it. Buy another one. At one point, I had 5 panini presses over probably 5 years. And my sister comes up from Florida in the summer and spends time with the family, her husband and the kids. And my other sister and my mom would just like clean and reorganize my whole kitchen so I can't find anything. I think that's the purpose because that's what happens every time they do it. But I had to give away panini presses because I had too many of them. So now I had the idea of buying an air fryer. And Sur La Table, which is a great company that makes amazing electronics and stuff, makes this very cool. It looks like a larger sort of toaster oven, you know, with doors, and you can do a whole chicken in it. You can do all sorts of things. So now I'm excited at the idea of using this little device to be able to make whatever kind of food and learn how to do it. And if I'm home or in the afternoon or on an evening or something, I want to have a snack, boom, put it in the air fryer.
Oh, yeah.
I know, like my friend Ray that I talk about at Estates Cleaners in whatever town he's in. Is it Roslyn? Maybe. The northern aspect of Glen Cove Road above Northern Boulevard. He makes steak in it, and he says it's amazing. I'm like, steak in an air fryer? I mean, I've never really heard it or had it, but yeah, why not? Or chicken or lamb chops or something, so I'm willing to try. I shall let everybody know on our next show.
Take some videos. I'll put it up.
Take some videos, how it turns out. I just like the idea of having something cooked nicely but not fried, like deep fried stuff. I don't like fried anything.
I'm with you.
I'd rather have grilled calamari as opposed to fried calamari.
I'm with you there.
World of difference.
Couldn't agree more.
So, yes, that's the state of affairs. So thank you all for listening. God bless you all. Give us a call at the office, 516-794-0404. We'll help you out. Go to the website, drcalapai.com. QR code. That should be working. We made that up the other day. And look forward to hearing from you again.